We have cytological features اللي لها علاقة بالسيل نفسه. We know that neoplasia, there is abnormality bil DNA. DNA, where is the DNA found? In the nucleus. So when there is abnormality bil nucleus, we have abnormal variation bil nuclear cytoplasmic ratio. We have multinucleated cells. We have uh, abnormal variations bil cell size, bil nucleus size, bil shape. We have a lot of changes. إما nucleoli become double nucleoli. Many changes. We will see it بالسلايدات القادمة. Slide number 6. As we said, increased number of nucleoli, nuclear cytoplasmic ratio. نحن قلنا nuclear cytoplasmic ratio يشبه البيضة النوكليوس اللي هي كأنما صفاري النوكليوس، والسيتوبلازم هو الأبيض. So nuclear cytoplasmic ratio normally speaking هو 1 to 3. لما يختل هذا التوازن يصير 1 by 1 or a nucleus more 2 by 1 معناته I have dangerous cellular features. Atypical or abnormal mitotic features. Hyperchromatism يعني عندي البنفسجي لون بنفسجي بالcells become very dark. These are all cellular features that could be related to pre-malignancy or oral epithelial dysplasia. Slide number 7. These are the combination of structural cellular features. You can see the first, so droplet shape. The second shows hyper keratinization and abnormal mitosis, loss of polarity, hypercellularity. These are structural features of oral epithelial dysplasia. Slide number 8. شوية ما واضحة الصورة, but you can see the abnormal cellular changes. prominent nucleoli يعني تكون كلش واضحة. hyperchromatism, nuclear pleomorphism, nucleus abnormal shape, altered nuclear cytoplasmic ratio, and multinucleation. هاي كلها cellular changes of oral epithelial dysplasia. It is important to understand them in order to understand the classification اللي we will speak about in the coming lecture. Slide number 9. The more prominent or numerous the criteria, the more severe is the grade. يعني oral epithelial dysplasia has a classification. Before كانوا يقسمون الأبو الباثولوجي كان ياخذ التشيو الابيثيليوم ويقسمها إلى ثلث الأول ثلث الثاني وثلث الأخير. و if the changes were in the first يعني بالثلث الأول كان يقول mild. Oral epithelial dysplasia is mild. 2/3 moderate. 3/3 a classification يعتبر severe. When the oral epithelial dysplasia changes are within the whole epithelium and very prominent, they call it carcinoma in situ. يعني الكارسينوما within the epithelium. هذه تجي قبل ما يتحول إلى سكوام سيل كارسينوما. لمن I have oral epithelial dysplasia إذا كانت mild, moderate or severe أو حتى I have carcinoma in situ اللي هي الستيب قبل دخول السكوام سيل كارسينوما. التريتمنت مالتها بس surgery. You remove the lesion. White, red, speckled, ulcer, an unhealing ulcer for a long period of time, more than 2 weeks or 10 days. هذه كلها potentially malignant features. إذا أبو الباثولوجي يقول لي it's oral epithelial dysplasia خلاص treatment surgery and you confirm the diagnosis and you have free borders. يعني البوردرز كلها normal، معناتها أنا الليجن كلها all of it was removed, excised. If I have a break، يعني ال basal cell layer has been opened and I have escaping of the cells inside the underlying connective tissue, the oral epithelial dysplasia تحولت from benign to malignancy، تحولت إذا مثلا squamous cell carcinoma or basal cell carcinoma or any type of carcinoma. Why? Because carcinoma means metastasis. Why, when it becomes in the underlying connective tissue, becomes malignant? Because we have lymph nodes and we have blood vessels. معناتها هاي المalignant cells اللي هربت the underlying connective tissue could have a chance to metastasis to other locations in the body. Slide number 10. This is the criteria for scoring, يعني classification. I have structural changes, I have cytological changes, I have the grade or classification. When I have everything is normal, I have no dysplasia. When I have the lower third, I have lower third, middle or upper third. Normally speaking, it could be lower mild, 2/3 moderate, or upper 3/3 هو marked or severe. But the WHO أضافوا 2 other changes. What did they say? Mild, moderate, severe افتهمناها. إذا كان 1/3, 2/3, 3/3. Sometimes upper third اللي هو نحن المفروض قلنا severe, sometimes it's not severe, it's moderate. Sometimes middle third اللي هو نحن normally نقول moderate, it could be severe. ليش؟ Because they take in consideration the cellular changes and the structural changes. يعني ما بس I have mild, moderate, severe. No. Sometimes middle third could be severe, or sometimes the upper third could be moderate. هاي مفهومة. آخر شيء when I have full thickness، يعني من البيسال stratum basali للcorneum كلته I have structural and cytological changes، هاي يسموه carcinoma in situ، يعني carcinoma within the epithelial layer. Slide number 8 العفو 11. These are images of structural and cytological changes. You can see the droplet-shaped retipex. You can see the abnormal mitotic figures بالhistopathologically وبالnormal، يعني بالdrawing الرسم يوضح الchanges اللي قد تصير. Slide number 12. Carcinoma in situ. It is the grade of oral epithelial dysplasia before the basal stratum basali opens and cause the cellular, the neoplastic cells to escape to the underlying connective tissue. Slide number 13 يعطينا رسم للسquamous cell carcinoma and the oral epithelial dysplasia، وعندي قسم من السيلز went to the blood vessels and this will cause metastasis to the underlying, toward the other organs of the body, mostly squamous cell carcinoma إما to the lymph nodes اللي هي بال head and neck location, or sometimes they go to the metastasis to lungs or other organs of the body. This is the end of chapter 19. I thank you for your kind attention.